On the town hall tonight, what to make of the news that Johnson & Johnson vaccines are on hold. You've heard the headline, but we'll dig deeper and take your questions to an expert.
Plus, everybody is talking about the Erie County executive saying that you'll have to be vaccinated to get into a Bills game this fall. Is that legal? We'll talk with one of the foremost experts on the Constitution.
And an important update on vaccination cards, with the state health department clarifying something everybody should know after getting their shots.
We are glad you're here with us today, everybody. We're going to start with that news from the federal government today regarding the Johnson & Johnson vaccine, because there really is a lot to unpack. We know that you have a lot of questions.
And we're going to get some expert insight in just a moment. But first, here are the facts. There are 6 reported cases of severe blood clots. They were all in women between the ages of 18 and 48, and they were between 6 and 13 days after they received the 1-dose Johnson & Johnson vaccine.
That's why the CDC and FDA are now recommending this pause as they investigate. And joining us live to discuss right now is Dr. John Selleck, hospital epidemiologist with Kaleida and an infectious disease expert. Dr. Selleck, thanks for coming on. We knew that our goal today for this show needed to be kind of providing some clarity to people, so we appreciate your time.
Thank you for having me, as always.
Yeah, Dr. Selleck, you and several other infectious disease and public health experts have really become very trusted figures in our community throughout the course of this pandemic, and we always value the perspective and the expertise, but especially now with news like this. So many people wondering, how concerned should we be by the Johnson & Johnson headlines right now, and maybe even more than that, the decision to put it on pause?
Well, I think that the important thing is for everyone is to, push the chair back and take a deep breath before getting too worked up. I saw Dr. Del Rio this morning said, don't freak out over this, the same kind of message. I think that what this shows us is that the mechanism that we have in place for monitoring the safety of vaccines and other products like this is working. As the reports of these came in, they did a preliminary look at what the data showed, and then said, this is a good point to take a deeper look at what's going on, and recommended that the pause take place. Now, obviously, this particular complication was also seen with the AstraZeneca vaccine, which is a similar technology in Europe, and a number of European countries have also put in these kinds of pauses. So what we expect that they're doing right now is they're looking at the occurrence of these particular clots, which are very unusual. It's called, the large veins that drain most of our brain. And those clots actually occur with a particular frequency out in the community, regardless of vaccines or not. So what they're going to look at are what we're seeing with these people, these women who got this vaccine. Is it different than the rate that we would expect to see out in the community? And it's a little bit more complicated than that, because the epidemiologic data are based on whole years, and we've only been using this vaccine for about a couple months. So I suspect that we'll see some more information soon.
Yeah, people always wonder, the causation, right? Just because something happens doesn't mean that the vaccine actually caused it. I'm sure that there are people out there watching right now, though, who got the Johnson & Johnson vaccine. Dr. John Torres with NBC News, who's been on this show a lot, said earlier today that if you got that shot more than a month ago, your risk, it seems, is incredibly low, probably nothing to worry about. But for people who got it within the past 3 weeks or so, is there anything that they can be on the lookout for? Specifically, there was a viewer named Nicole who emailed us earlier today asking, what kind of signs can you keep an eye out for just with this kind of blood clot issue in the back of your mind?
Yeah, it's really not going to be something that shows up to be very obvious. It's going to be things like a severe headache, changes in your ability to think straight, anything that suggests that you may be having something neurologic going on, weakness in arms or legs, changes in your vision. These would be things that I'd be concerned about. And again, if you have a minor headache, that's okay. But we're looking at something that's worse than what you usually would get, something that's quite severe. That's what we would be more inclined to be concerned about. But again, remember, this is 6 patients on a background of about 8 million doses of the vaccine. So the occurrence of this is extraordinarily low.
And you touched on this a little bit earlier, that a lot of health experts have gone on TV or social media today to say that this is the system working exactly as it should. You have an extremely rare side effect that may or may not be directly tied to a vaccine, and it's being investigated. Do you think the federal agencies have handled this the right way? And what do you say to people who point out how rare it is and maybe saying, you know what, this is making too much out of nothing?
Yeah, this is a very, very important point because the FDA is walking on a tightrope here. It's a double-edged sword. On the one hand, there are going to be people who criticize them for doing this, and if they didn't do it, there would be an equal number of people criticizing them for not doing it. So I think they've handled this the best that they possibly can. The CDC has already announced Wednesday afternoon, tomorrow afternoon, there will be a meeting of the Advisory Committee on Immunization Practices, the ACIP, and this will be a very transparent, open discussion of what's going on. Again, I think I can't emphasize enough, the system is working the way it's supposed to, and I think the FDA did the prudent thing, and hopefully we'll get resolution of this quickly.
Finally, Dr. Selleck, in the minute or so that we have left, do you worry about hesitancy because of this going forward? We already know that there are some people out there who say they're not going to get the vaccine, and you and a lot of other people are encouraging everybody to take it. Do you worry that people are going to be now more likely not to want to get the J&J vaccine? And how would you convince someone that once the FDA and the CDC and all the experts go over this and kind of give their guidance, that people should trust that?
Yeah, this is a very important point as well, that we don't want this to be a sign to anyone that they should not get vaccinated. This side effect has not been shown with the Pfizer and Moderna vaccines. And I think that there will be such a thorough review of this that if it comes out that the FDA and the CDC say, look, this is no more than what we see in the background, it's safe to go, I think that should give a lot of reassurance to people that we're not seeing something that is new or specifically related to this vaccine, that the vaccine is actually causing to happen. And hopefully they will, then move forward and get it, presuming that we go back to using it.
And again, we appreciate this opportunity to go more inside the headlines tonight. Dr. John Selleck, thanks again for being here.
Okay. Thanks again, guys. Be safe.
Thank you, Dr. Selleck. We appreciate it. We have an important update tonight as well, and sort of a correction to a story that we brought you last week about vaccination cards. Of course, those 4-inch by 3-inch little pieces of paper that have the CDC logo on it that prove that you've gotten your shot.
So specifically, many of you asked, if you lose that card, can you get a replacement? So here's part of the story we aired Thursday with a direct quote from the New York State Health Department.
What if you lose your card? Well, experts recommend you make a photocopy or take a picture as soon as you get it so you'll have a backup. But if you don't worry, you can get a replacement. New York State told Two on Your Side the following, quote, "It's important to keep proof of your COVID-19 vaccine in a place that is convenient and safe. This can be accomplished in a number of ways, including taking a photo of your card. If you lose your proof of COVID-19 vaccination, you should contact the New York State COVID-19 vaccination hotline at 1-833-NYS-4VAX, and we will provide you with a copy of your immunization record from the New York State Immunization Information System."
That phone number that we just mentioned, we know it's hard to remember and write something down so quickly, so we want to share it with you again. It's 833-NYS-4VAX, VAX. So, after we aired that segment, and I made a big point of sharing the phone number for a long time, and Kate laughed at me, we got calls and messages from some viewers saying they lost their cards, they called that number to get a replacement, and they were told, yeah, we don't do that.
So here's what we found out about this. Even though we asked the state health department specifically about vaccine cards, and their statement referenced the cards, they inexplicably referred to that toll-free number to get a replacement record.
Yeah, it turns out a vaccination record is not the same thing as a vaccination card. State Health never told us that. It seemed like they were talking about the same thing. So just to clarify, that hotline, that phone number that we gave you is if you need a replacement record, but not a replacement card. To get that, the first thing you need to do, if you need to actually get the card, you should just go back to where you got your shot. So for instance, if you went to a Walgreens, you can go there and you should be able to get a replacement card.
Yeah, and if you got vaccinated at a state site and you don't have a primary care doctor to help you, you can contact that hotline to help with a replacement card.
Yeah, I know that it seems a little bit confusing, and trust me, we were confused in the emails going back and forth trying to make sense of what the state health department was saying. But the record is kind of just like a digital certificate or whatever saying that you got vaccinated. But if you want the physical card, it's a different process.
Yeah, it should not be this hard.
It shouldn't. All right, coming up on our town hall, will vaccines be required for Bills fans at the stadium this fall? We talked about it last half hour. The county executive says yes. A top legal expert will tell us if that's legal next.
There is still a lot ahead on the town hall. We'll be back right after this quick break.